Thank you so much, everyone, for joining us this evening for the screening of Home. It's been great to see the comments in the comment section. I know that we have some questions that I will be asking both Jono here and Doreen, but we do have a Q&A box. And if you, as the audience, has some questions that pop up, please feel free to use that Q&A box and we'll try to get to those questions as well. Allow me to reintroduce myself. My name is Sonia Castaneda Cudney. I am the program specialist at the Sachs Institute for Mental Health Law, Policy and Ethics at USC's Gould School of Law. We are doing this event in collaboration with the Diversity, Equity, and Inclusion Week at USC. And we will be popping that link in if you're interested in more of the sessions. Tomorrow's the last day, but there still are really great sessions happening this week. So I'm so happy that you all could join us for the film Home. Today, we are joined by Jono Oliver and Doreen Gallagher. Jono is the writer and director of the film, and he's based in Brooklyn. And as I understand it, this was your first feature film. Doreen Gallagher is a psychiatric nurse. She's based on City Island in New York. I'm so excited to have you both here to talk with us about this film. It's beautiful. I really love it, and I'm so happy to get to share this with everyone.
Yeah, appreciate it.
um, Thank you. I actually just would love to start today to hear the story of the film. How did this film come to be? And I know before this we were talking a little bit about how you two met, so I'd love to hear that story as well. Again.
Right. Well, yeah, no, firstly, thank you guys for hosting the film and having us here and thank everyone for watching it. It's always fun to look at it. I've seen it a few times. It's been a couple of years, but it's always great seeing it again. Yeah, I did this, I mean, it's a while ago. We shot it about in 2012, came out in 2013. And before I had done this film, it was my first feature film, but I've worked in film before that. I'd worked for about 20 years as an assistant director, and I'd done a short. I'd written a couple things, and I had an idea to do a TV series about a mobile crisis unit in New York that kind of is based out of a hospital and goes out and deals with people in need. I thought that was a good idea for a show, still a good idea for a show. And I was working on that, and I wanted to do a lot of research because my parents were social workers. So I think that's kind of maybe where it came from originally, that, my dad was, he was the administrator a psychiatric center out in Bushwick, Brooklyn. If anyone knows Brooklyn, in Bushwick in the 70s and 80s, I'm sure he saw his share of some stuff. And I didn't really know what he did other than that. My mom was a school social worker. So I guess it's kind of the family business. I never went into it, but I've always been interested in mental health and just people and how people can fall through the cracks. And I used to tell this story a lot when, you'd sit on a subway in New York and you'd see someone in the corner who's not doing well, 40, 50 years old and peeing on themselves, whatever, just out of it. And I would just go, where, like, when did it happen? Was it since youth or what? Like, it's always just been an interesting thing because so many of us now, today, we just kind of walk by, you do your thing and you try, it's easy to tune certain people out. So the original idea for the other series and for this, when the series didn't happen, it was a bunch of overlapping stories. And one of the characters, it wasn't the same character that Benga played so wonderfully in this as Jack, but it was a similar story. And so I figured, let me try to do a film just to tell something. It's easier to do an independent film than sell a pilot to a studio. And actually, it was, CBS had actually looked at it, but it didn't get developed or didn't get shot, I should say. So I wanted to do this movie. So it was hard. We kind of, by hook or by crook, and a lot of people, and it's, I understand we do these talks and we always cut the titles because I've long credits at the end because there were so many people who helped. If anyone sees the movie again, everyone who's watching, if you ever see the movie, it's a nice little song we had done, but it's like 5-6 minutes of just name after name because so many people worked for free and gave their time And yeah, and you know, we were all very proud of the movie, and I think a lot of people joined because of what it was about. Because it's hard to make movies like this, and it's hard for people to see them, and that's why even today, if you guys, you know, when you guys show it, if people can just keep it going, we've heard so many good things about how it can open a conversation and make people think about stuff, and
Mhm.
yeah, so it's been an honor to present it. And just really quickly, how I met Doreen is when, you know, I said, you know, although my parents are social workers, I'm not trained in mental health. I don't know, but I love writing. One of the things I love about writing is doing the research. Like, I'm now working on a series about music and this whole era of music, and I've just been for a year just kind of getting into that and just trying to, you know, it's a fun way to kind of secondary education, but you do it yourself. You know, nowadays on YouTube and everything, it's a lot easier. But I met Doreen at some trainings. I would kind of literally kind of sneak into trainings for mental health professionals and get the handouts and just try to get my head around what the world is and how people do. And Doreen, actually, we talked a little earlier, and she reminded me that I met some of her and her coworkers, and she can explain more about where she was working. And I've met some of her consumers that she would spend time with, going to lunch, or I remember went to a Christmas party, and just to try to, you know, it was really tricky because I wanted to tell the story, but I also write things, and I always have like the there's always, well, whether it's subtle or not, there's always the message I want to give out. And this was all about stigma and trying to present people just as people. And it's funny, even, you know, when people say, oh, it's a guy with schizophrenia, which is accurate because there is one little scene where you see the word, but we never say it in the movie. And that was like a conscious choice, that to let the audience kind of just get to know people as they are. And that's with everyone in the home, from his roommate, you know, played by Victor Williams. I mean, everyone there was just so, and a lot of those characterizations of people, Doreen was invaluable being on set to help make sure that, you know, you want it to be real. And in real life, it can be scary and it can be something that's unknown, but we also wanted it to be real, but accessible, if that makes sense. So anyway, and we'll talk more about it, but that's kind of where it all came from, and why I wanted to make the film, and yeah, here we are.
And I think that it was important that it be ethical, because I think even if we never really discussed it, I think Jono and I each understood the vulnerability of the population the story is about. And of course, you know, I'm very protective around that. So when you see the character of the nurse, I think, you know, some of the things she says are things I say. So I'm like, oh, did he hear me say that? Like, you know, are you good to go? Or, you know, homeless shelters are full of people who thought they knew better than everything. You know, so, you know, I would speak to the patients, which now, you know, a phrase that's new now is like recipients of care, you know. So they're not below us, they lead our team, you know, which is our philosophy now more. But you know, it was important, you know, to protect that vulnerability and the ethics behind, we didn't want to exploit people or make their life trivial or perpetuate stigma. We wanted to bring, I felt like we had a duty to care for the process and the people whose lives were sort of, the characters are like a composite of millions of Americans and people around the world who suffer with an incurable illness. It's treatable, but it's not curable. So it was, you know, very important that Jono and I shared a common set of morals and values around it. And I think we did. I mean, there were times where Jono, I don't know if you remember this, where he would say to me, I hope you don't think that was, you know, and I was like, no, it was, I never had an issue where I felt he wasn't true to the promise, you know? So I haven't seen the film straight through in a while now. And I mean, I'm very proud of what Jono envisioned and how he implemented it. And, you know, the fact that we're talking to you about it, you know, this population, because you're important to protecting them as well.
Definitely. Thank you so much for that answer. I agree with everything that you said, and I actually think that that work and that attention and that care really comes through in this film, which is why it really spoke to me, and that's why I wanted to share it, because I think um, it just is a beautiful story about people who are living their lives and dealing with what they're dealing with. And it just, we go through that with them. And again, not like labeling anything. It's really just a story, and there are all of these parts to it. And I think you do such a beautiful job with telling that story. So thank you
Thanks.
both.
I will say one thing that's kind of interesting is that I do know that because of the content matter and the audience, that when it first came out, there were some people who were very reluctant to show it to groups in the community because I mean, I took it as a, I took it as a compliment as much as I could, because they said that some of the reality of it was, it could be triggering. And it was very interesting that I hadn't quite thought, you know, I mean, I thought of it, but not, it's hard to put yourself in, if you aren't going through that and don't look at certain things from that perspective. It was interesting to hear, you know, mental health professionals say, well, I don't know if we're going to show that, because I know there's some people who would not be able to handle it. And of course, you know, for them, it's probably not the right film, which was a little bit surprising me, because that's kind of who I really, you know, if I thought who the audience was, I would have been like, oh, it'd be great if everyone can look at it and try to get some kind of, but it's, you know, I know it's a tough movie and there's a lot of, you know, a lot of curveballs, and it does have a happy ending, but it takes a while to get there. So, but it was interesting when it first came out, that was kind of a concern that I hadn't thought of with respect to the reality of it. But, you know, like I said, I take it as a, as a compliment. You know, glad it's real.
And you know, like what I liked about it is it kind of went straight up against the stigma and stereotype of like Nurse Ratched, this horrible woman from One Flew Over the Cuckoo's Nest, you know, like, you know, patients to this day, people still like, oh, Nurse Ratched, you know, it's just the most horrible label, a psychiatric nurse, you know, it's terrible, you know? So I really loved the way KK portrayed the nurse. And I really love the humanism that motivates her and the other folks that play staff, you know, that you could tell, like, you know, even though it wasn't always like the perfect relationship, I think one of the opening scenes, the nightmare scene where he wakes up violent and the staff is on top of him, and in the beginning maybe it takes the viewer a little bit of time to understand it's a nightmare. But what we never could have known back then, that we certainly know now, is that vulnerable people are choked to death by people in authority in these brutal interactions. And that was never on our radar. And when I saw that tonight with new eyes, I really appreciated the nurse stepping in and saying, "You're choking him, let go." And that courage that it takes in a violent situation to be on the right side. And I feel like that scene has taken on a whole new layer for me.
That's a good point.
And we never could have known that back then.
No, but it is a dynamic that's always been at play. And I think you said it. It's now a lot of people can see it in a new light. But it is something that's always existed.
Right.
and
And the
so-
abuse of psych patients still unfortunately exists, but it's much better now because we do have, like in New York, the Justice Center, where they have immense power, the attorneys and the professionals, to process complaints in real time, and they're very powerful. So yeah, it was very interesting to watch that through these eyes, you know.
Definitely. So you spoke a little bit, Jono, about where the inspiration for this film came from, and you said maybe from having parents who are social workers. Can you speak a little bit more on that?
Well, I guess I mean, what I meant by that is just, I think there's a lot of people who are just ignorant about this even being an issue, or if they do see people with mental illness, it's through the prism of films or you know, places that may not take the care that we try to take in presenting people who are well-rounded, and the story's different. You know, I mean, you know, I said this, we said this when we started talking, Jordan. I'm sure I remember I had something I kept saying that, you know, people who are dealing with things, mental health issues, they're either like a joke or a psycho killer for a long time in films. And I think it's, you know, there's once in a while you'll get a film where there is a person and that's the story. And, you know, for my movie, that was the story. But for the most part, yeah, people are jokes or psycho killers if they're dealing with something. And I, you know, I still think there's a way to go, but you know, I think the environment and society is better. But as far as the you know, the how I wanted to tell the story, I mean, it's, you know, I write and I just kind of, you know, I mean, I looked at this, I was like, man, there were a lot of people, you know, we kept putting people in it and workers and patients in the place. And then we started getting such great actors, and a lot of stuff happened once, you know, we had these and everyone there was so into it, and they just took it. You know, everyone says in filmmaking, you know, there's all these, you know, percentages that directing is 50% casting or 80%. It's probably like 80 or 90% casting on this. And because everyone was just so great. And even, you know, going back to KK and how Doreen worked, you know, we went and visited, there was an adult, you know, when I was doing research, wow, it's all coming back now. I must have toured like 5 or 6 adult homes just to see how they worked all over the boroughs. And I would get tours from administrators and Doreen took us, then when the movie started getting into pre-production, Doreen took a couple of us to a facility on 23rd Street that's a very big, I mean, hundreds of beds, I assume, or 100 beds, something like that.
It's actually a very famous in law. I mean, you guys are lawyers. So in law, this was a groundbreaking case where they took what was a rundown, infested, horrible place that was like several hundred rooms and in disrepair with the most awful landlord you can imagine. And New York State and New York City came together and they won this groundbreaking case to seize the property from the landlord and put him in jail on felony charges for perpetuating the abuse, including prostitution and murder and every kind of horrible thing you can imagine that would happen to a vulnerable person. And then they completely rehabbed it to, at the time, state-of-the-art independent mental health housing with on-site services. And I had patients living in there. So in my outreach work with the assertive community team and the mobile crisis team, I was there all the time. And they had very high security. And, you know, so I brought Jono there because that's kind of like the place Jack didn't choose was probably that. And he didn't want to be in a building full of people with disabilities or, you know, so it was, you know, interesting. And then a couple of my folks who lived there agreed to come down and chat with Benga and Jono, and we stood up.
KK is what I was, and with KK, and that was what really I noticed when she was rehearsing or getting into it. I could, you know, she was really studying. You know, actors are really amazing because I think like I approach directing, I think kind of maybe a little like actors do. Like I really want to kind of get into whatever I'm talking about, so it's as real as possible, and you can make changes, whatever. But I remember seeing KK talking to one gentleman in particular. I remember, and you saw the whole. It was kind of like, how do I, you know, psychiatric nurse school, but you know, over a 30-minute conversation in the lobby. But it was very fascinating just to see, because it's a very, you know, you want to portray it in a real way, you know. Nurse Ratched, unfortunately, in some places is real, but we didn't want that. So
we didn't want that. I mean, it was important to me that we had that understanding. And when I watched, you know, KK tonight, I'm like so proud of her that I think her nuances of being a caring person and a human being, you know, who happened to be a really cool psychiatric nurse. So I was very happy with the outcome there.
Thank you. I will mute myself when you are talking, so I will try to remember to unmute myself each time I try to talk again. Another thing that I really noticed that I think was subtle but very present in the movie with the staff and the housing situation was that power dynamic that does exist that I do think often gets overlooked or for service providers that's not always considered. You don't always remember how much power you have in these situations and over someone's life, actually. And I think you did such a great job with showing that, and showing that there is distrust there, and for good reason, but also that um, that not everybody is I mean, you're going to get each different situation, I guess, is what but
Well,
I think very well shown.
well, thanks. And there too, and it's funny, I said to this earlier, because I've had a couple talks over the years, and Doreen's name always comes up because a lot of the stuff, like I knew that Parker was going to be the bad guy, like not bad guy, but he was going to be the one who was the antagonist to Jack. And it was a comment, I remember, stuff's coming back, but I do remember Doreen gave me this whole conversation about how doctors, psychiatrists, and psychiatric nurses do often, either out in the open or, just kind of buried, but there's always conflicts over treatment or power or whatever it is. And so that part of that came into it, which I think was helpful, just to help, me make it.
And also like the turnover. This is like, when you think of physicians, psychiatrists are among the lowest paid, and they have a very important job, but it's typically like a single biller. It's like they provide talk and prescriptions and lots of things related to that, but they're not surgeons. They're not, banging the anesthesia, and you know what I'm saying? They tend to be underappreciated themselves. So we do, and these patient populations are intensive. So it's not for everyone. We have a massive shortage of psychiatrists in this country. And during the pandemic, that was revealed in so many ways, particularly the explosion of telepsychiatry, because you really don't have people that stick around or get compensated well. Like he had to leave all those times, not because he's a jerk maybe, but because he's working 3 and 4 other gigs on the side.
Yeah, that was his backstory. Remember, his backstory was that he has a private practice somewhere and he comes every other Friday because it's, he considers it his duty or whatever, but he's making money somewhere. Yeah, that was
right.
Which,
and that's how the programs are budgeted. Like they can't afford much more. So when you go into mental health, you're not making a lot of money. There's always those few that do somehow, but typically from private pay, affluent people.
Well, and thinking about that, it really does, again, speak to those power dynamics when there are powerless people with power over a population of people. Those things can get really messy. So thank you. Great points. We did have a comment here about the housing. The housing issue in the film was so well hit on. And I really love Victor's character where he's like, I have my basic needs met, basically, and that can help me to be who I am, and understanding that the priorities are obviously different for everybody, but the housing, Jono, you did such a great job with touching on that. Can you speak to that a little bit? Where did that come from?
My first answers, and I don't really know. I think that unfortunately, I think everyone who lives in New York is familiar with housing issues and not having enough and trying to find the right place or, getting the right. I mean, I'm a freelancer and trying to get an apartment, even, I do okay and I work and stuff, but even, that was just something that a little easier for me, I think, because it just seemed like a general kind of New York housing thing, but I know Doreen could probably work, the idea of housing for people who are going through this. I mean, all I can say is that when I was touring and seeing people, it kind of strikes you as what those, as hard as it may be for someone like me who can fill everything out fine and has some kind of, ability to kind of negotiate or whatever. it does strike you that someone who doesn't have all those facilities lined up ready to go right now would have a very, very hard time, especially in a position. And that was his big conflict. The hard thing about this movie is that for some people is that it's this guy's struggle, and what I liked about the idea I had before I wrote the script, and then when I wrote it, is that it's life and death. Movies are, a lot of people's favorite movies are about life and death issues, but you can really see the death and you can see the life. This is a guy who wants to get his own apartment, but I like that as being for him, his life or death. Is his validation as an independent person, his validation as a father, his validation to prove that his ex-wife was wrong and that he can be on his own. There's a lot of really, really important stuff. The way Benga played it and the way it was written, I like to think, and yeah, it's interesting because it's the kind of movie that often doesn't, it kind of gets overlooked. So I don't know, that doesn't answer your question about housing, but I guess what I liked was just these small things that we all kind of often take for granted, that for some people is this monumental challenge that I thought was interesting to explore. So.
And the reality too is when you look at benefits, if the typical severely mentally ill person is getting SSI, they're only getting about $750 to $800 a month in New York State. So if they get into subsidized housing like New York City public housing or some other mental health housing that's subsidized, typically that's at least a third of that check. And then if you're in other services, the Medicaid, you need to renew it annually. It's a slippery slope. So when you look at like Victor Williams' character Hamilton, he's not being lazy. He may be at a point of recovery where he appraises his ability to survive. And if he's only going to get, even if he had a work history and got some SSD, you're talking about people living on $1,000 a month. That's crazy, right? So if someone's in recovery, we don't have to know his whole story. But I think when you think of the bigotry about, benefits and entitlements, Social Security and Medicare, Medicaid, people just speak from such profound ignorance when they say, get a job. We wouldn't say that to someone with end-stage renal disease, right? Or end-stage cancer. We try to treat it, everything you need. But when someone has the unfortunate diagnosis of something like schizophrenia, schizoaffective, bipolar, and a particularly severe presentation of it, what a horrible thing to say. It's like they can do so much to maintain their wellness and recovery and treatment, but it is not a model of cure. So talk about diversity and, disparaging, healthcare groups. I mean, it's outrageous. We made a lot of progress, but we have a lot more to make.
Most definitely. Well, and I think, again, Jack's character is not only dealing with mental illness, he's also dealing with a record. So it's hard for people to get jobs in the United States. It's hard for people with serious
Right.
mental illness to be hired and to find a job. It's hard for people with records to find a job. It is hard for people of color. It's hard for Black people to find a job. So I think it really showed all of this very well in the film. There was the you people conversation, and it's sometimes the jobs that are available are the ones, most times the jobs that are available are the ones that offer little to no security.
No benefits.
No benefits, yeah.
And this is before, Obamacare. So it was a very different world.
I was going to, one more thing about the housing. One thing that I realized, like looking at it again, is what I tried to do. It's such a complex situation. And, I didn't do the movie to come up with any answers. I wanted to tell a story about a guy, but also, like I said, kind of make some, some points about stigma and about how to treat people better, but also just that I felt like it was important to show all these different perspectives of people in that system to facilitate a better conversation. Because if it's just one guy and then it's like you're with them or you aren't. But it's been fun hearing talks and hearing people talk about it. And you talk about Victor's character, or one of my favorite changes is Danny Hawk, who plays Dundee, who's the guy who has it together and it's all good, and then you find at the end he's actually in a shelter and he's not really taking, and he's kind of, and it's such a tragic end to the guy who's kind of like the mentor. I mean, I don't want to go on just about what I like about the movie, but all of it was very intentional to try to give different layers to a very big community, so there's not just one of anything. There's and even the kid who's trying to get his driver's license, that's his life or death. We just tried to put a lot of just try to show people things that maybe they didn't think about or weren't aware of. And, it's not a documentary, but we tried to just keep it real in a lot of ways. And yeah.
Well, and I think that you basically answered my question here, but maybe we can speak a little bit more on it. As representing serious mental illness in this film and doing it in a realistic way, it sounds like it was extremely important to you and to the whole crew. And it sounds like you set out to do this in a different way than it has been done in the past. I would love to know, for cast and crew, and I know that we have the two of you, but from everybody else that I spoke to when I was reaching out for people to join us in this talk today, everybody had such wonderful, positive things to say about the film. And I'm wondering if you can talk a little bit about how working on this film was received or changed people's perspectives.
Well, I think I'd never had this. Well, okay, that was my first film as a director, and I will say, I'm gonna be completely honest, we didn't get money for it. And we had investors, but I put up money. We did Kickstarter back then. You could do Kickstarter, and we made like 30 grand on that. And actually, in the weird way, Kickstarter for me wasn't really okay. Now we have the money, we're gonna make the movie, because our budget was a lot more. We spent about 300,000. That was the budget, about 300,000 on the movie. We originally had a movie of a couple million, but we never got it. And I was just like, I want to make it. It just became one of those things. And then when I got the Kickstarter cash, I was like, all right, well, now I definitely have to make it, because I'm not going to send back checks to 300 people and say, oh, I'm not doing it. So it's kind of like, it kind of kept it. So for better or worse, we finished it. But what the whole reason I started that story is because it was a very, it didn't have a low budget feel, but it was small. It was intimate, and we got lucky with locations, like the place that had the group home where the beds were, this place called it was called the Hebron Center. It was like this huge building that used to be a nunnery. It was like 5 stories tall. It was a whole city block in Bed-Stuy, Brooklyn. And I looked at it and I was like, I just need this for 2 weeks to do a film. And they're like, well, the 2 weeks you want is the 2 weeks we're on vacation. And they gave it to me for like no money. Like, we had a lot of really, really fortuitous location things and actor thing. I mean, James McDaniel, who played the doctor, Parker, like read it on a plane, got off, like, yeah, I'll do it. And we're like, we're not paying, people really were, we took care of them as best we could, but it wasn't a TV show or a movie salary, and they were changing themselves and bringing their own clothes. And we had a big setup, but it wasn't that kind of thing. There were no trailers. I mean, it was a small film. And so I think part of that came out on the screen a little bit, especially amongst the cast, when you see those scenes of them together. I think a lot of that there weren't trailers, that we were all kind of like, in this real building.
Sweating.
Say it again.
Sweating. Remember how hot it got?
It's all other thing, but
in the summer.
So it was different for me. So there was a lot of frustrations because of that, and it's like, when you're spending your own money, you want to move quickly. And I probably, I've been directing lately a lot of TV stuff, and I mean, you're still moving quickly on that, but you just have an infrastructure for it, but you also don't get the same kind of thing. Well, and for me, being a writer director, I don't think I'll ever be as free as I was on that, because there was no one standing there. I could have everyone read the phone book all day long, and we would have shot it, and no one would have said anything, until it's done. But so that was a luxury, and I think it afforded us the ability to tell the story we wanted. So I can sit here talking to you years later and not go, yeah, I wish, but the producers or the studio or whatever, or the cat, it was kind of exactly how we had planned it. And I wish we had paid our investors back, but maybe there's still time in the in the window of people being able to watch stuff on TV. So anyway, but it was
But
it
I
was a
would,
great experience.
yeah, and I would add too that it was such an interesting. I agree with everything John was saying, and with the tech and the crew behind the scenes, I can't tell you how many of them, in between, the time of, the takes or eating something or fixing a camera or whatever's going on, how many people came up to me and told me a story about their own mental health or their own experience with treatment, mostly not good stories, or how they knew and loved someone, a friend or a relative who, could easily be one of these characters, and the impact that had. And I think you can't plan that. Like, people just gravitated toward Jono. I think because, he is a nice guy and people love him. And I saw that people really did go above and beyond and had a belief in the film as a social statement, not just art.
And I'm glad you said that, because I had never gotten more people coming to me I mean, not as many as you probably, but there were a handful of people who would just, I felt like I had like the doctor is in sign on my
Yeah.
little folding chair, because people would come and just kind of rap about, and I knew then that a lot of people were there doing it in, I mean, I'm gonna say bad conditions, but no one made tons of money, but they were doing it because they really supported the project. I mean,
Yeah.
we also, people were kind of bumping up and they had a chance, and, we ran a good ship, but I think, a lot of people just really wanted to tell a good story, because most of the time when we work in this business, you're doing, you guys see what's on TV, everyone sees what's there. And every once in a while you can get something that's good and important, that tells something that, is good with a capital G, which has kind of been my goal. And that is my goal now as I continue as a filmmaker. But more often than not, you do get the check, but it's, it's a cop show. Well, there's nothing wrong with cop shows, but it just, it doesn't really have, there's maybe the moment that's really cool, but it's not like the whole thing is telling a story that you could argue is something that hasn't been seen, or that's necessary to help some people. So anyway, yeah, but it was a good bunch. And like I said, if anyone watches it again, just check the credits. There's so many people. It was fun.
Can you tell us how long it took to shoot the film? Because I feel like you
20
had an
days.
accelerated
21
schedule.
days.
It was accelerated.
The first day was all the running. The first day was all the stuff on the street. And then because I kind of was comfortable with that and I wanted to get out of the way, and I said, if we didn't get it all, it would be fine. It felt like a good way to start. We kept running for the next 20 days, but that's the first day. And then the second day, the first scene was with Joe Morton, who played his dad. So that was the first acting scene of the whole thing, but that came out well. Yeah, it was 20 days, and a couple long ones, but for the most part, they were normal for film. Yeah.
Wow. I know that you, Jono, had mentioned that the film has been screened at some of the NAMI locations in the United States. Can you speak to that a little bit?
Yeah, they've been really great. Well, when it first came out, we tried to, I wanted to partner with, I mean, it was a long period of trying to market this thing when it came out, and they were kind of the only ones who were a little bit interested in it, but there was no real, it was like, oh yeah, someone would show it here and there, but it never really got legs. I don't think, although it seemed, every once in a while people were like, oh, I saw the film, and wherever they see it, Amazon or whatever. But NAMI's been terrific. And you know what it is, when it first started, when I was doing all this research, what I was talking about with Doreen, I also became a member of NAMI, and I would go to some of their meetings, which I think were in person. I can't remember what it was, but I kind of just got on their mailing list, and I would get their material just to, like I said, just to try to get immersed in that whole area. And that was actually really, really helpful for figuring out the relationship with the ex-wife, because NAMI's very much built from, family and peer support and all that stuff. So it was really cool seeing their whole philosophy about, it was a whole other side of it. It's not treatment, it's not patients. It was kind of like the other people. So that was really fun to learn. And then when it first came out, NAMI Wisconsin did this big thing, and they had a big fundraiser, and they wrote up this big, I mean, they really kind of embraced it really nicely. And I know some of the people saw it, and they still show, I mean, other people still show it. It just showed in a NAMI branch in Ohio a couple of weeks ago. It's just funny how it just popped, they'll send a thing, hey, can we show it? Yeah, it's great, because you do realize that people there, a lot of them who are consumers, really do get they like seeing this representation.
Yeah,
That
it
like I said,
resonates
it's
with
too
them.
often.
Mhm.
Yeah, it's too often. Um, it's not really reflective of what people experience. So, yeah.
I saw a question pop up actually from our audience, and I think it's a great question. I think it kind of, we can lead into this one. What kind of conversations did you have at the start of production with the cast, and in particular, Benga?
Wow.
Well, so about Benga, it was interesting. Benga he had a very strong take on how the character should be played based on personal experience and just studying a lot and knowing a lot about it. And there were two guys I was looking at, and I just felt he was the right person. He had a certain, and we talked earlier about kind of straddling the line between things that can be scary to people or intimidating, and just a person. And he just had that, like, he's such a nice guy in person, and even when he was kind of losing it, it felt like it was real. But he's just trying, I don't know, an actor brings a lot of who they are to it. I mean, obviously and he brought a lot of great things, like certain twitches. Like he does this thing with his shoulder that was like a
Yeah.
medication side effect. He had there were a lot of little things we worked on. So I guess to answer the question, like, we would talk about that with the actors. Every actor I'd done because there's so many of them, what I wanted to do, and it's funny, I wasn't a very good director. I did okay, but it was my first time. I was very controlling of everything. And although I gave stuff away because I couldn't really. So when it came to the 6, 7, 8, however many patients in the room, when they were doing the group, like, I wanted everyone to have their full-on bio. So I kind of gave her outline to people, and then they would fill in the rest. Remember, Doreen helped with it too, with like KK and with a couple people, but with like, Elena, who played his friend, like, everyone just had all these complex. So we did spend some time during rehearsals and during fittings and stuff, just to really try to make sure that people were dialed in on who they were. And if they had questions, let me know if they need to help figure it out. But I really gave a lot to them to just come up with their own thing. And I think it worked really well.
And one thing that you did was, I don't know if you remember this, when we were, what was it, on Gold Street, and you arranged this tremendous table read with everyone in this big huge square, and then part of the schedule was he gave me, maybe, I don't remember now if it was an hour, but it was sort of like the quick abstract of the life of a mentally ill person, and what were like the basic, what's the basic profile of schizophrenia versus bipolar and depression and addiction, and kind of the different feel for it. And the actors, I had a riveted audience. They were really into it. And then, as John said, he did give each of them a nice chunk of, this is what I see you as. And they were not kidding. I probably met with every single person at least once, if not more. And they would just kind of like, well, am I on the right track? I don't want to do the wrong thing. But, like that balance of, you're a technical person, I want to help you with that. But to allow the creative interpretation of the actor and the words, it's art, but you want to be true to the population you're trying to tell the story for. You know what I mean? So that was interesting. Like, I was very much aware that I wasn't there to teach my students. I was there to provide information for them to interpret and for Jono to direct. And they were his words.
Thank you for that. That was such a great question. Thank you, audience, for that question. Now, I want to know now, then today, like, if you were to make this film today, is there anything that you would change, or is there any, I mean, I don't know, this is kind of it's definitely a hard question, but I am curious, like, how you think with your experience now today, would you change anything?
Yeah, it's a hard question. I thought about that because someone asked that recently, and I don't know what to say. Yeah, I would change stuff for sure. I'd work on the script more, probably. I would do something different. I don't know what, but I've seen it so many times. I would do. It's tricky because I say, wow, it would be nice to have something that sold and we made the money back that we spent on it, but it would not be the same movie. And those people who like it now may not like it. It may have had a bigger audience, but I think it would have lost something. And I don't know if I would have, I can go to sleep at night. And I told this is one of the things, like, I just want to be go to sleep. I had two criteria. I said, I want to make a movie that I can watch every year or two and like not hate it. And two, I want to make something where I can sleep at night and not say, wow, I really kind of screwed that up and it's here for, whatever. And on the second point, absolutely, like, I'm really proud of the film. And people would say, so, wow, it's like a foreign film, which I took as a compliment too, because it's kind of slow and it's very introspective and it's performance heavy and there's no, that's what it is. So it's a tricky question. I mean, do I wish things were different? Maybe, but then again, maybe not, because now I'm writing something and part of what makes you better the next time is maybe seeing what you did the last time. So, yeah. And it's funny, the thing I'm writing is about time and changing time and choices and stuff like that. So I'm right now, I'm like, it's all good. Like, that's how I have to look at it, that, we all got it alive and we made a good movie, and, next time we'll try to pay people back. But for now, I just, if people like it and if your audience likes it and you guys show it, then we succeeded. So,
Well, I think it is a success. So thank you again.
yeah.
Well, and also Home won awards. Can we talk about these awards that Home was nominated for?
Yeah, well, I'll talk about two that I was happy with, which was SAMHSA and there was another one, the Voice Award. That there were two mental health groups that gave us awards for our depiction of people going through what they went through, which was very, that for me was kind of the highlight of it. And some festivals liked it, but some did. The award thing is tricky. Like, I'm not really an award guy, just because sometimes you win, sometimes you don't, and it very seldom seems like it's based on anything other than, whatever. It's an art, and just to be able to do what we do what I do, I'm grateful for it. And that's about it. And there's one thing that hit me, and I'm not sure why, but there's another thing about all of the people. And one thing that was very important to me was in the casting was to make a very inclusive, ethnically and with respect to gender, like to make sure that it kind of represented everybody. And even though the majority of our actors are people of color, were people of color, and that was certainly, by choice, but it's also Brooklyn. But, there were also people there who I wanted to just, I'm not going to say that's how I casted people, but it was definitely a concern, because it was, I assume it still is now, but at the time, especially, mental health in the African-American community was something that was just kind of, it just wasn't talked about, and there was people falling through the cracks more than other. And I assume it's gotten a little better, Dorian. I don't know. You probably know, or probably not. No, same. I don't know. I guess during.
I mean,
whatever.
it's
I don't politics, but
yeah.
but the point of what I just started saying is that was also a real concern of mine, to make sure that we represented a truthful picture of Brooklyn and these facilities, and that was a big part of it as well. So people could see themselves, even if they didn't catch the story, they'd see the person.
Right. And I think it does capture a certain period in time. Enough years have passed, right? So, yeah, I think that the general public doesn't realize in the pandemic, the first things hospitals had to do was shut down psych units and other like considered unnecessary services like endoscopy and OR. We shut down all these different services so we could open more COVID beds and save more lives. And mentally ill people and people in treatment for addiction, whether or not they were also mentally ill, and like Jack is a person that has a history of addiction. It's like, I don't think anyone understands. That's why your cities are overflowing with violent, mentally ill people and addicted people. It's not just like in New York also that we free people from our jails more quickly, but the reality is our jails have become the state hospitals. So we have all this surge in people who decompensated psychiatrically, went back to using substances, and had no treatment options. Outpatient was shut down because of social distancing. Telehealth didn't take off yet. And we still have quite a number of pretty sick people that are on the street, not linked to treatment, similar to Dundee. And you can see in New York, and I'm sure in California, entire neighborhoods that were once considered affluent during the pandemic were overrun with mentally ill people who were just living right on the street in front of, multi-million-dollar apartments, and it was quite an ugly scene here, and it brought up again racial disparities. So the rich white people don't want the, brown sick people on their street. So it brings up a lot of wounds. So I think if you tried to tell the same story now, you probably would have to go into those more like political things that happened, and how we lost a lot of progress with how sick people are now compared to before the pandemic. So we're actually suffering in that area. And we still don't have enough psychiatrists or housing or benefits or, and the last 4 years of federal policy did not help.
Definitely not. And today is the anniversary of when really COVID picked up a year ago here in the United States. And so talking about this, I think, is very important. And looking at this and looking at how things were then and how things were challenging then for individuals. And I do really want for our audience, I'm sure all of our audience is thinking about this, but it's okay to be uncomfortable with it because that's not okay. And we should definitely be doing work in this area and setting up more supports because we don't know what this pandemic is going to mean for our collective mental health. So I think we're overdue for investing in mental health services and supports. Well, I wanted to talk also about, for you, Jono, your time working in film. Can you tell us a little bit about why film? Why did you choose this area for your art? Or is it where did this come from?
Well, it's fun. It's very similar to the reason I wanted to make this movie. When I went to college, graduated with a degree in political science. I worked at a software company because they were hiring people. I didn't really want to do it, but they gave me a check and I was happy. I was working with friends from school. And then I started taking a film class after I saw Spike Lee's, one of his first movies, She's Gotta Have It, which is his first kind of famous movie. And I looked at it and I said, wow. And the images that, it was Black people in Brooklyn, and it wasn't about that though. They were just living their lives and dating. I don't know if anyone's seen the movie, but it was interesting because until then, it struck me that, wow, I haven't really seen that. Like I see, you see cop shows and there's Black actors and, there's the Sidney Poitier. I mean, there's comedians, but I'd never seen just like a regular small drama just with people. And I said, wow, that kind of when I need to back up a little bit. I don't make too long a story of this, but when I went to school and I was majoring in political science, first I thought I was gonna be a lawyer. Then I was like, I don't want to go to law school. And then I wanted to work for like a social service organization. So I applied to like Urban League and Red Cross and AIDS Project LA. I applied and didn't get any jobs. I'm like graduating from a decent school, but didn't get like one offer. And says, I worked in a software company. And then when I saw the movie, I put it together. I said, wow, maybe I can tell stories on film that kind of will reach people the way I would have done just through kind of outreach. And for better or worse, I started a career as an assistant director and didn't really write my own stuff. So you're working on other things. And that's what I said before, you make the check, but it's not, it's not like you can hold it up as like, well, here's a great contribution to discourse or society. Not that everything has to be, but once in a while it's nice. So that's kind of how I got into film, was to tell those stories. And hopefully now I'll be getting back to that. It's kind of, you work for other people and you try to work for yourself and keep the balance, and hopefully it all works out. I don't see, did she leave? Did she drop off? I don't see her.
It looks like her internet has cut out, but that's okay. I'll just another attendee question. So we have, has working in television renewed your faith in stories like these being told?
Not really. I wish I've been, and it's funny because every time I see this film, I go, man, I had an idea for a series of it, and it's a different kind of, it was a different structure, but basically it's like each season and you go through a bunch of people and they're trying to there was no interest, I don't think people want to tell stories just like this. I think there are TV shows that do a good job of it, and they will have characters they will include where they can have it's important because so many people watch TV that would be great if more people would tell stories like this and get these kind of conversations working and have people aware of the issues. But right now working in TV, it seems like it's all content, which, the word everyone's like, oh, we're making content as opposed to storytelling, which I think is a big distinction personally, but that's a whole other topic. But, what I do like is that the fact that people here are appreciating this film means that maybe there are people who appreciate other ways of telling stories like this that need to be told. Yeah, if I can make some more TV, maybe I'll try to get mine there, but easier said than done in a big way.
Great. We have another attendee question. It's a bit of a long one, but I will try my best to read it all through. It says, the film touches on the relationship between the sufferer and his son and the mother of his son, and offers a powerful account of their opinions, but also the consequences of their opinions on Jack's ambition versus realism. But similarly, their opinions from before the film, when Jack was deteriorating, through the persistence affect Jack today. Does the film have a perspective on whether their opinions were helpful or unhelpful in this prior time?
No, it's a great question. It's a really great question, but the answer is no. And that's why it kind of comes back to what I was talking about before, and having so many different stories and so many different characters who have different perspectives. I like asking questions and not necessarily answering them all. I mean, I have a point of view, obviously, and I think if you watch the film, you can get that. And hearing me talk, I think you get that. But no, a lot of this is not. You figure out what happened. Even the end, some people are like, "Well, what happened? Is he okay?" And I'm like, that's for you to. I mean, that's what I like when I watch a film, is that if you're invested in characters and you kind of make up your own story, and you kind of, it's like a handoff. You set it up and give it to someone if it's done well, and then maybe it sticks with them and they fill in the blank. So I don't have an answer to that, but it was a good question.
I mean, what I would say that I always kind of saw in the story from just my own experience of the story is that I'm not sure people really understand the grieving and loss that people go through. Not just the person who develops the mental illness and the loss of what might have been or could have been, especially when people get sick when they're in high school, college, young adulthood. Like, John tells this story, well, my college thing didn't really work out, so I just did something else. Well, if you went to college and the stress of that experience and you're away from your family, and the next time anyone really sees you, you're already in the throes of your first psychotic break, you're not guaranteed you're going to recover. So in the story of Jack, I mean, you clearly see he lost his mother, who, we don't know a lot about that. Was she also mentally ill? Did she have cancer? But she was like the one person in his life that he felt never abandoned him through it all, right? His father could care less. He didn't seem very nice to me. And I do meet people like that all the time, where it's like, whatever, move on. And then you don't really know that connection. And then he had, who appears to be a beautiful wife at one time, who loved him dearly, a son. And then he lost all that. So there's a tremendous layer of, depression and grief and loss and, like constant sort of, struggling. He just wants to be normal. That's all he really wants. And he doesn't even have straight recall of all these things he did that people are so upset with him. So, I don't know if anyone really understands that, like, that is a horrible, horrible side effect of mental illness. There's a lot of grief and loss.
And trauma,
I-
and it's very disorienting.
And-
Exactly.
And I absolutely, I agree with everything Doreen said right there, but I will say that it goes back to what I was saying before about just kind of personal stuff, is that if he had gotten it without everything he went through, would he be in as good a place at the end as he is having gone through it? You know, but that's why I say I like asking the question, because his ex-wife comes to the door, and that moment is so sweet with Tanya saying, this is good. And it's not him, you know, stumbling around trying to figure it out. He did that, and then he finished. So I guess what I'm trying to say is sometimes you have to go through the fire, and then it you know, without his father being the way he was, without, who knows? He's a fictional character, but it's fun to think about.
Right.
You know,
But it's like so
what it takes for people.
powerful. Like,
Yeah.
you know, it's never stated, but she's clearly pregnant. Her new husband seems like an amazing guy that he's putting up with, you know, these outings and everything. Like, these are clearly good people who want to do the right thing. And the love of the son is shared by all of them in that little triad, you know. And now there's a new baby coming. And the thing that always like went through my mind with the story is, and it's never spoken, but how do you know John won't inherit his father's mental illness? So there's that idea of to give John everything he needs, and he's 12, he's not a baby anymore, but you don't know. So there's a lot of issues that come up that are never spoken. And you read into it, I think, what like Jono paints that picture, and you look at it and you see what it is you'd like to see.
Well, and I think with Jack and his father, that scene this time around really hit me as his father's coming from a place of pain and wanting for Jack to pay back what his wife may have done, and like how he was hurt by his wife. And so when Jack reminds him of her, it feels like he's going to, I don't know, there just really felt like some serious hurt and anger that was misdirected. And that really hit me this time around, actually. But again, you're saying that's what I'm reading into this situation.
Protecting him. If you've ever seen a very violent, severely mentally ill person, I mean, he could have murdered that child in another scenario. He was out of his mind, setting the furniture on fire. I mean, I've seen these cases where it's just, I think she's courageous to ever give him another chance. Many people would have gone on, order of protection, get full custody, you go away forever. But
I was speaking about Jack's father and that relationship. But I think you are correct. I think there was a very ever-present aspect of trust and hurt and pain, and it is very difficult to, when you have been surprised by someone who you do love and trust in these very very dangerous ways, wherein your child was put at risk, your life was put at risk, your house, your family, everything. It's a lot to ask someone to trust you again. And I think you did a great job again, Jono, being realistic, where Jack's not saying that he said he is cured. He is in treatment. He is doing what he needs to do. But that's an ongoing process that's forever. And he cannot, and he doesn't promise his son that, he doesn't say, I will never do this again. He just is like, this is where we are, and this is where I'm going, and this is what I'm trying to do, and I will keep trying to do it. And I thought that was a really, it's realistic.
Yeah, for all of us. I mean, that was easy. That was, I don't want to say easy, but that was easy for me to tap into. It was like, let's make a plan and try to do it. And even like I said, those of us who think you have things together, mean, we're all different levels of our own mental health issues, but you think you have stuff together, and sometimes it doesn't work out. And then what do you do next? And it's a cope. It's like that's human coping. Is what something doesn't work out, you have to adapt and do something else. And I actually liked the fact that a lot of what all of those characters go through are things that those of us who aren't in those situations can deal with and empathize with, hopefully. I mean, that's the key. For me as a filmmaker, if you do something and get someone to empathize with someone maybe they didn't before, I feel that's a big victory, so anyway.
I do want to apologize. My internet is terrible right now for some reason. So I'm sorry that I have been disappearing. I am trying to stay and catch everything, but I'm having some trouble here. So if I do go off again, I want to say thank you in advance for this amazing conversation. And I want to say thank you to our audience for joining us. We have a ton of interest in the film as well, Jono, for different purposes. So collect that information. And I do also want to let everybody know, I also lost my ability in the chat, so I can't see what's happening. But we will, and the events team is on this, so we'll collect that information. And if there were questions that went unanswered, we can do our best to try and get some more answers. But definitely we will share. Jono, do you want to plug the film? Where can people see the film? How can people share the film if they want to as well?
Thank you for asking. I think the best way is on Amazon. And if you go to homethefilm.com, just home the film, what is that? 10letters.com. You'll see links and you can look at it that way if you want to sign. It's cheap, I think. It's a couple of bucks. So yeah, hopefully if you know someone who might want it, please share it. Yeah. Appreciate it.
I would. I mean, we're not finished here, and I'd actually really love to know what projects you're working on, Jono. And Doreen, what are you up to these days? What's happening?
I'll let Jono go first.
Yeah, well, I've been directing. I'm taking, because of COVID, I did a couple episodes of a show called For Life, an ABC show about a man who, it's kind of right up my alley based on this, a man who is wrongfully incarcerated, and then he gets a law degree in prison, then he comes out and takes cases. And a great British actor named Nicholas Pinnock is in it, and Tim Busfield and a bunch of people. So I did a couple episodes of that, which was fun. But there too, you get the script, and for someone, and I've realized this only the past 4 or 5 months, I've been writing another pilot, completely different. It's about music in the 1970s, and it's just fun, and a different kind of research, a lot of listening to songs and watching videos, which has been really refreshing during this time. But so I'm looking forward to that, because even though I do love directing television, there's always that moment where you get the script and you're flipping through it, and you really hope that there's not that bit in it that you just can't stand. And I'm not talking about bad, I'm talking about something that I feel like is an image or a storyline or even behavior that I don't want to see on TV personally. But you're hired and you're paid, and you really can't, you can't make those changes. You just kind of grin and bear it. And I guess I'm at the point, and and it's funny, these talks with you, and again, thank you so much for having us here, because when I sit here and I talk about why I made that, it reminds me why I'm doing this in the first place. And fortunately, I'm at the position now where I can take off a little more time and try to finish the script. So to try to just get my voice out there, because TV, and this goes, someone asked the question on TV now, are you going to, are you happy that TV, like, I don't think you would see a show like Home on TV, not now, I just don't, it's just, there's little interest. And it's also hard too, because people are going through so much themselves. I know that a movie like this can be helpful, but it can also be something like, I got enough in my own life. I don't need to see someone else going through it. So it's tricky, but yeah, I want to do a little more of my own. I do a lot more of my own thing, as opposed to just kind of, working on a cop show, which I like, and they pay the bills and it's all good, but we've seen it.
Thank you, John.
So Doreen, what are you up to?
Wow. So, well, I'm a psychiatric nurse educator in the biggest health system in New York. So my office is in a psych unit. So I've never left. That's the thing I love. And then, I think I mentioned before we watched the film that I do a lot of volunteer work. So I started where my community went through a terrible time with heroin and opioid morbidity and mortality and horrible generations of people dying of addiction. And we had no
City Island?
help. Yeah.
You talking- Really?
City Island, it got really bad. And, so I started my own program and we have the numbers down so low now that I don't even really have to do much outreach at all, which is great. I love when I'm put out of business. So, and I do a lot with veterans and military families. And I'm kind of known as like, oh, the psych nurse on City Island. So people will like reach out to me a lot of different mental health stuff, nursing stuff, and I love it. And with the pandemic, we were hit very hard here. I don't know, out there in California, the Bronx had like one of the highest densities of lives lost in the United States as a county. And on City Island, we did lose a few people, and the whole island was saturated with COVID. And we're known for restaurants. They were all closed for months. So we had a lot of people out of work. And so I was very involved with that kind of stuff, like fundraising and helping feed people and mask making. And, so now hopefully like that'll all calm down and we can go on to something else. So, and I would love to work with Jono again. It's been too many years. Got to be some story we could tell.
Yeah, well,
You
there
never
are always
know.
stories to tell. That's the good thing.
Well,
Good or
thank
bad?
you both so very much for joining tonight. And thank you, audience, for joining this evening and for watching the film and joining in our conversation. It was really a pleasure to do this. Thank you
Thanks
so much.
Thank you,
My
Sonia.
pleasure.
Thank you,
for
Doreen.
having
It's great
us.
seeing you. Yeah.
Yes, we have to get together in the real world.
will. Yeah, let me get one of those shots and we'll talk. But
Yes, get your
I'm
second shot.
trying.
All right. Thank you, everybody.
Thank you, everybody.
My pleasure.
Thanks.